Now, I know that with that summary about what we did and its differences with President Obama's plan, that explanation is not going to satisfy everybody. And I respect the views of those who think that we took the wrong course and who think we should have taken a different course. I also recognize that a lot of pundits around the nation are saying that I should just stand up and say this whole thing was a mistake, that it was just a boneheaded idea, and I should just admit it. It was a mistake and walk away from it. And I presume that a lot of folks would conclude that if I did that, that'd be good for me politically. But there's only one problem with that. It wouldn't be honest. I, in fact, did what I believed was right for the people of my state. But there's more wrong with the President's plan. I believe it's an economic nightmare. It does not lower health care costs overall in our system. It raises taxes. It diverts Medicare funds. And it kills jobs. Let me tell you, as I go around the country and talk to business people, and I was one for 25 years, when you explain and when they understand the implications of the Obamacare program on them, they're less likely to hire people. They're concerned about the cost of Obamacare on their ability to hire and train workers. It kills jobs. It is, in my opinion, one of the reasons why this recession has taken so long to get out of, and why we have 20 million Americans unemployed, underemployed, or have ceased looking for work. But now let's look at what I do instead. You won't be surprised here, because what I'm going to describe to you is basically the same structure that I described 4 years ago when I was running for president. I should note, by the way, that was a time when my Massachusetts health care plan was considered, at least by me, to be an asset politically. I hear some laughter in the room. That's not the case now. But you will note that despite the fact it's gone from being seen as an asset to being seen as a liability politically, that the plan I'm going to describe for you is the same. I'm not adjusting the plan to reflect the sentiment, the political sentiment. The plan, in fact, starts with the same elements. And let me begin with what I consider the objectives of my plan. One is do no harm. Two, strengthen the current healthcare system by lowering costs and improving quality. By providing portability, that's the ability to know that you're going to keep your insurance if you change jobs. Improve consumer choice. And then expand healthcare by dealing with those individuals who have pre-existing conditions fairly, and provide greater access to care for those that are low income or uninsured. 5 principles. Restore states to leadership. Empower individuals to purchase their own insurance. Focus our federal regulation as opposed to making it overbroad and over-bureaucratic. Reform our medical liability system. And introduce market forces to health care to the extent possible. First, Obamacare raises taxes. I don't. He diverts Medicare for Obamacare. We do not divert Medicare for a health care plan. His creates massive new federal bureaucracies. Mine creates no new federal bureaucracies. His reduces consumer choice. I dramatically increase consumer choice. His, I believe, will raise health care costs. Mine lowers health care costs. His involves massive new government spending. They admit to $1 trillion over a decade. It'll be a lot more than that down the road. Mine reduces government spending. His includes mandates on individuals, on corporations, and on states. Mine includes no mandates. We let the states create their own plans. His is dependent upon the federal government deciding who's poor and how to insure them. Mine gives the state the responsibility to care for those that are poor and uninsured. His discriminates on a tax basis against individuals and small businesses, by the way, where individuals often don't get coverage from their employer. Mine provides for tax fairness. And in my view, his includes overly broad pre-existing condition rules. Mine has, I think, fair and reasonable pre-existing elements.